on the call. But I do want to start our webinar. Thank you. Welcome to our March Tobacco-Free Tuesday webinar. I'm Gina Roberts. I'm the Southwest Regional Coordinator here at the Tobacco Control Program. On our call, we have Tiffany Eustace, who's the Northwest Regional Coordinator. We have Natalie Gaspadinov, who's the Northern Regional Coordinator, and Nicole, who is in her new Nicole Mann, who is now our Cessation Coordinator in our central office. So welcome everyone to our call. We have an exciting webinar today. We have some representatives from the American Lung Association to talk about the state of tobacco, both nationwide and in Virginia, and maybe how we can kind of improve what we have going on in Virginia as well, and what we need to work on. So excited to have them. They're going to have a great presentation. Before we start, I wanted to do just one quick poll to see if you know just a little bit about where Virginia may be right now. And so the question, and I think Tiffany is going to put it up here, is how does Virginia's score compare to others? How does Virginia's score compare to other states? Better, way to go. Virginia's always leading the way. Virginia consistently is above other states with their tobacco policies. Average, so that means, we're not bad. Virginia tobacco policies fall in line with most states. Or worse, we have lots of room for improvement. Virginia can improve upon their tobacco policies in many categories. So take a couple seconds and think, where is Virginia, kind of where you work or what you know about Virginia's tobacco policy? What might that look like? Drum roll, okay. Average, not bad. Okay, Virginia's fall in line, or worse, 44%. So that's actually a good breakdown. I think it may be leaning more a little bit on the worst. We do have lots of room for improvement. And I know each of you and the state tobacco control program is looking to improve, and we want to know how we can do that and what we can do better. And we're working each day to do this. So I would like to welcome now our presenters from the American Lung Association, Thomas Carr and Aleks Casper, to present on the state of tobacco in Virginia. And Thomas Carr has been the director of the nationwide policy at the American Lung Association since October 2010. And in this role, he directs state and local tobacco control policy efforts and assists with federal tobacco control policy and asthma policy efforts for the Lung Association. He is also the primary author and editor of the Lung Association's annual State of Tobacco Control Report, which we will hear much about today. I'm excited to hear about. And he also the state legislative actions on tobacco issues online database and website of state tobacco control laws. Mr. Carr is one of the country's most knowledgeable experts on state tobacco control laws and policies. He has a Bachelor's of Arts in Political Science from Gettysburg College. So welcome, Thomas, to our webinar. We also have Aleks Casper, and you may have seen Aleks on some of our meetings and some of our calls and webinars in the past. Aleks serves as the Director of Advocacy for the American Lung Association, covering Virginia, Maryland, Delaware, and the District of Columbia. She has held this role for the past 7 years. Prior to joining the American Lung Association, Aleks spent 15 years in a variety of roles, including overseeing government affairs in multiple states for the March of Dimes, which focused on maternal child health. Aleks is a graduate of the University of Delaware with a Bachelor of Arts in Women's Studies. So thank you both for joining us. We look forward to hearing where we stand and how we can improve. And I will turn it over, Thomas, to you to start the presentation.
Wonderful. Thanks so much, Gina. And welcome to everybody on the call. I'm definitely pleased to be here, and good to meet everybody virtually. We're here to talk about the American Lung Association's State of Tobacco Control Report today, which evaluates states and the federal government on key tobacco control policies. We plan to do a broad overview of what the report is and the areas we grade on, and then get into more detail about Virginia's grades with comparisons to some other states as well too. We'll be switching back and forth between me and Aleks a little bit a couple of times, so you'll get to hear from a couple of different speakers here. Next slide, please. But first, I want to briefly mention the benefits of tobacco control policies generally, which is one of the reasons why we feel it important to evaluate states and the federal government in our State of Tobacco Control report each year. The point I would focus on in particular on this slide is that tobacco control policies can often protect hundreds of thousands or even millions of people at once. A great example of this is smoke-free workplace laws, which once implemented in a state or community drastically reduced exposure to secondhand smoke in public places and workplaces. I'll also note the tobacco industry is hard at work and puts a lot of money behind making the use of tobacco products seem normal or even desirable. And one of the goals of tobacco control policies and tobacco control programs should be to counteract this. Next slide, please. So this is an image of the homepage for State of Tobacco Control, the State of Tobacco Control website this year, available at lung.org/SOTC. The report is released annually, and the 2025 report was released about a month and a half ago on January 29th, 2025. The website has detailed information on each state's grades, a key findings section that serves as an introduction to the report, and state rankings pages that have maps displaying the grades for all 50 states and DC. There are a few pages unrelated to the grades on the website that may be of interest too, including a tobacco control milestones page with key developments in tobacco control since the 1950s, and top 10 lists that talk about diseases caused by smoking and secondhand smoke, and tobacco industry marketing, among other topics. You can also download a PDF version of the report on the homepage as well too. Next slide, please. So I just wanted to share a few of the main external goals of our State of Tobacco Control report on this slide. We do have internal goals for the report as well. The first goal is super important to the Lung Association, as we want the report to be a catalyst for strong tobacco control policy change at all levels of government. The report generally draws significant media attention across the country when the report is released too, especially at the state and local level. However, the grades can be used throughout the year as an accountability tool, especially as lawmakers consider legislation that could change the grades. Next slide, please. And so here are the 5 state tobacco control policies currently graded on the Lung Association State of Tobacco Control report. Flavored tobacco products is the newest state grade in the report, having been added to the report in State of Tobacco Control 2021, so about 4 years ago now. The report's kind of evolved over the years in terms of scope as well too, so we've had different grade changes, different methodology changes, and that kind of thing. Next slide, please. We also grade the federal government on 5 different tobacco control policies in the State of Tobacco Control. I'll talk more about these grades in a little bit when we talk about the grades for the federal government earned this year. But these are kind of the 5 grades here, or 5 areas here. Next slide, please. This is the 23rd year. Amazing. I've been here for a good chunk of this, so it's hard to contemplate. We've been doing it that long, but the Lung Association has released the State's Tobacco Control report. It has evolved over the years in terms of the state and federal policies are great on the report and the scope of those policies as well too. So, next slide, please. In state tobacco control, each state and the federal government receives a letter grade, A through F, and each of the areas graded on. Grades are benchmarked against the best in the nation tobacco control policies or recommendations from federal agencies, such as CDC's best practices for comprehensive tobacco control programs. We published the complete state and federal methodology for the report on the website. It is included in the full PDF version of the report as well. We'll talk through the methodology more for each state grade later on as well. Next slide, please. So each year, as part of the State of Tobacco Control report, we pick a theme to focus on as part of the report in addition to the grades. For the 2025 report, we took a look at the tobacco industry and specifically some of the aggressive actions they've been taking in the past few years to protect their profits at the expense of public health. One of the most glaring examples of this is the effort that tobacco industry undertook to stop the Biden administration's menthol and flavored cigar rules at the federal level. But they have also been aggressively opposing flavored tobacco product laws and trying to get preemption of stronger local laws put in place in states across the country over the past several years. The industry has also been introducing new tobacco products into the U.S. market without U.S. Food and Drug Administration authorization in many cases. In some cases, these products are pretty egregious too, having video games or other things like that built into the products. Next slide, please. So here are the grades the federal government received in the 2025 State Tobacco Control Report. The main change in the federal government's grades this year was the minimum age of sale grade changing from an I for incomplete grade to an A grade due to FDA finally issuing regulations for the federal law increasing the tobacco sales at the age of 21 in December of 2019. So only 5 years later. We were hoping for a positive change in the federal regulation of tobacco products grade, but unfortunately, former President Biden decided to not move forward with the menthol cigarette and flavored cigar rules. Next slide, please. And then on the next 2 slides is the overall grade breakdown for the 5 state categories graded in the report. As you can see, many states still have a lot of work to do to reach the goals set in state tobacco control. We did see some positive news on the tobacco prevention funding front, and we have been seeing some positive news in that category for the last few years, with 6 states registering increases of 1 million or in some cases much more in funding. However, 3 states did see decreases in funding of the same amount. So some forward progress, but maybe 2 steps forward and 1 step back in this case. I'll just note also that Oklahoma is perhaps an unexpected A grade on tobacco prevention funding. It is due to them setting aside tobacco master settlement agreement funds into a voter-approved trust fund. And is really using the tobacco master settlement agreement funds for their intended purpose. Unfortunately, for the 13th year running, no state passed a comprehensive smoke-free air law. So we were really starting to see a very large lag in terms of that going forward. Next slide, please. During 2024, we saw a small amount of progress in the tobacco taxes category, due mainly to a large increase in tobacco taxes in Maryland that Aleks will talk a little bit more about later. And there was also improvement in several states in the access to cessation services grading category. 20 states now have a comprehensive quit smoking benefit for their state Medicaid programs, a number that has been increasing over the past 10 years. We've been seeing some pretty steady progress in that category. In terms of flavored tobacco products, there was not much progress in 2024. Next slide, please. So here are the best and worst graded states in the State of Tobacco Control Report this year, as well as states we've recognized as most improved. So good news for Virginia. It is no longer on the list of worst graded states, but I still say it's lagging behind many other states in terms of grades. Aleks and I will dig into why that is in a moment, but first it should be noted that no state receives straight A's in the report. So every state has some improvement to make in the tobacco control policy areas graded in the report. I'll now turn it over to Aleks for the next several slides. Aleks.
Great, thank you, Thomas. So Virginia, this is the Virginia highlights page. So when we issue our report card, the first page of the report card is always kind of the grades in the categories that Thomas mentioned, and we'll talk about them in a little bit. But then we also have the opportunity to do some highlights, which gives some Virginia kind of facts and figures on one side, but also talks about things that may have happened in the past legislative year and things that we want to continue to work on. And every year we identify kind of 3 priorities. Some of them I think sometimes can be lofty, but I think they're really meant to get the conversation started, right? So we do happen to get a good amount of media with the State of Tobacco Report. And so these are an opportunity to have the conversation and begin talking about the conversation. You will see, and we'll talk about it in a little bit, that our second priority is really about this tobacco surcharge and how do we make that permanent. And so we've got some news there to report a little later on down the road. Next slide, please. We wanted to take a look at Virginia versus the border states, so the states that surround Virginia, and see kind of where the grades fell. I think you will see Virginia, first of all, as the top line with all Fs and a C. I will note that all of the border states kind of all have that tobacco prevention and cessation funding as an area of opportunity, right? In order, we'll talk about how to move that grade up a little bit. But the other states, surrounding states, I would say, have a little bit more variations in some of their grades. And so I think it's important just to kind of look. DC, I will note, has all A's and an F. And Maryland had some improvements, as Thomas mentioned, and we'll talk about in both their smoke-free air category, as well as their tobacco tax. Next slide. And then we did do a comparison of Virginia versus the best states in the country. I think, again, just so you can see, even some of our best states struggle in and around the tobacco prevention and cessation funding. But you will see that there are areas of opportunity in some of the other categories, smoke-free air, tobacco taxes, the access to cessation, and then the flavored tobacco products. Next slide. So the flavored tobacco products, it's a pretty simple one, right? It looks at what point the extent has prohibited the sales of flavored tobacco products. The only two areas that meet that kind of gold standard or meet the criteria to get the A is Massachusetts and DC, both of which have laws that meet the standard, and really outside of DC, Virginia doesn't have any of the border states that would meet this criteria. Next slide. Sorry. So tobacco tax. I think that's one we talk about, a lot in some of the groups that I work in Virginia. And so we wanted just to kind of show that is something that we do include as part of our report. I think Thomas would say it is it is a known, we know that the tax impacts behavior. And so if we can prevent people from starting to smoke, and use a tobacco product, and tax is one of those things, we know will help do that. The average tax is $1.97. And then we also look at how other products are taxed. So are they, in equal or parity to how a cigarette is taxed? So several of Virginia's other products are taxed in parity with Virginia's cigarette tax. However, I think, the cigarette tax is really what's pulling that grade down, and it's 60 cents per pack. So it's well below kind of the midpoint. I will note that in comparison to our neighbors, DC is at $4.50 and they rank third in the nation, and Maryland increased their tax to $5 per pack and they rank second in the nation, excuse me. Next slide. So tobacco prevention and control program funding. It's not about what programs do with their money, but about how much money the legislature or state foundations are allocating towards the program. So how much money are we as a state saying, this is a priority for us, and this is how much we're allocating to prevention efforts. In order to get above an F, the state needs to spend at least 50% of the CDC recommended level. Next slide. And here is just kind of a snapshot of Virginia against some of the other states versus the CDC recommended level. And you'll notice, I think, on this slide that really DC and Maryland are probably the closest to that 50% number. I will note that DC received a bump this year because they allocated their Juul settlement money to tobacco prevention and control efforts. Next slide. And then again, this state is just kind of comparing Virginia to those states that did the best. And you'll see that even a state like Massachusetts, right, that is considered ranked among the best, still has an area of opportunity, for growth among getting to that CDC recommended level. And I will turn it back over to Thomas to talk about some of the access to cessation services.
All right, so this is kind of this is a kind of a somewhat complex grade, I would say. The access cessation services grade is composed of 3 categories: Medicaid coverage of tobacco cessation treatment, the investment a state makes per smoker in their state quit line, and then the state employee health plan coverage of tobacco cessation treatment. So Medicaid is weighted more than investment per smoker in the state quit line, and then state employee health plan coverage. Medicaid enrollees and then the uninsured smoke at higher rates than the general population. So that is the reason for the weighting of those categories. There are additional policies the state can have that causes them to earn extra points or lose points as well too. An example of that is the tobacco surcharge, which I know we'll talk about, specifically about Virginia in a little bit. The level of investment per smoker in the state quit line is the main thing that weighs down Virginia's grade. It's a little bit, fairly below the median investment per smoker, which is $2.26. So, and then also, but also then making the tobacco surcharge and the Affordable Care, moving the tobacco surcharge and the Affordable Care Act permanent as well too, will be helpful in terms of that gets you some bonus points too. Next slide, please. So there's another chart here that compares the various elements that form Virginia's access to cessation services grade compared to the states with the best grades in state of tobacco control this year. In general, the states with the best grades invest significantly more per smoker in the state quit line and also have minimal barriers to access in their Medicaid quit smoking coverage. There is some variation in the state employee health plan coverage. So Virginia's doing somewhat well there. Next slide, please. And then another chart that compares the various elements that form Virginia's cessation grade to the states that border Virginia. DC and Maryland invest significantly more dollars in the state quit line, which is largely responsible for the better grades there. Kentucky earns some bonus points for limiting the tobacco surcharge and mandating private insurance plans like Virginia cover tobacco cessation treatments. So they also have no barriers for Medicaid coverage too. Next slide. So let's talk about the smoke-free air grade for a minute. We made a change to the methodology for the smoke-free air grade in last year's report. So this is a 2024 State of Tobacco Control report. So it's now based on the extent a state prohibits smoking in public places and workplaces, with deductions in letter grades for certain exemptions. So an exemption for standalone bars or casinos would earn a B grade, and if both exemptions were present in the law, that would be a C grade. So it's basically just a straight letter grade deduction. There's also a letter grade penalty for preemption of stronger local laws as well too. What hurts Virginia's grade the most is the complete lack of smoking restrictions at all, state smoking restrictions at all in private non-hospitality workplaces, and the limited smoking restrictions in other public places. This includes the allowance for smoking rooms in restaurants. And while I'm not sure bars technically exist as a legal entity in Virginia, or we commonly thought of as bars as well too. This would also include smoking continuing to be allowed in the new casinos and relatively new casinos in Virginia too. And then finally, not including e-cigarettes in the law also would be an issue if the state smoking restrictions are stronger. So, in terms of comparison to the states that border Virginia, DC and Maryland have comprehensive smoke-free laws that prohibit smoking in restaurants, bars, and in Maryland specifically casinos. And include e-cigarettes and marijuana in their laws, so they earn A grades. Tennessee's state law covers most public places and workplaces, only exempting small workplaces and over age 21 establishments. West Virginia gets a D grade in this category due to the percentage of population covered by comprehensive county smoke-free regulations. So it is not based on its statewide law, which is even weaker than Virginia's. Next slide, please. So there's no question that the Lung Association State Tobacco Control Report sets a high bar for states to meet. The report does that because the Lung Association believes that only strong tobacco control policies will put the country on the path to ending tobacco use in this country for good. We are also often asked why we don't issue one combined grade for states, And that's because all these policies, when implemented together, have an even greater impact. So we do not want weaknesses in some areas to get covered up by an overall grade. I'll turn it back over to Alex for the last couple of slides on recent Virginia legislative activity. Alex.
Great, thanks, Thomas. And so I just wanted to quickly kind of sum up a couple of the legislative issues that we at the Loan Association were involved in, or also kind of monitoring. The big one for us this past legislative session, excuse me, has been the repeal of the tobacco surcharge. And I think, you know, many folks know on the call that the tobacco surcharge was repealed. So the tobacco surcharge, excuse me, allows insurance carriers to use someone's tobacco use status to charge more for their premiums. So these typically, the data shows that these kind of punitive measures don't work. And for many cases, people will actually forego care altogether. And so in 2023, we worked House Bill 1375 and Senate Bill 1011, which would repeal the surcharge. When the governor went to sign the bill, he added a sunset clause. So it would sunset as of January 1st, 2026, and also had the State Corporate Commission issue a report saying, you know, does this work? Essentially saying, we want to see if it works before we make any further decisions. And so the report, I think we put the link in here. The report has limited data. I think with the limited data, it does show, it looked specifically at populations of Virginia that had higher smoking rates, and to see if there was a change in enrollment in healthcare. And I think they saw slight indications of change. So that was good. Again, the report is there. It's pretty limited. But we worked this year with Delegate Hope to introduce House Bill 1639, which essentially removes the repeal and makes it permanent. There was an amendment added last minute to add an extra year of reporting, which the State Corporate Commission wanted, and we were all fine with, because I think it's great to have that continued data to show that the policy is working. The bill did pass the General Assembly and is waiting on the governor's signature. We have, I'll talk about it in the next slide. We are doing some messaging to the governor to ask him to sign that bill. And it's something that you all can engage in as well. And we'll talk about it in a minute to make sure you're getting those emails from us. Next slide, please. I did want to flag, because we talked about the impact of tax, and I think something that we have seen across the nation is really some threats to both tax and smoke-free air laws, I think, from the cigar industry. We did have a bill that we've seen before in Virginia that would cap the tax on cigars to 30 cents per cigar. It was amended in committees in both chambers to change to a study bill, and then the bill died. We did oppose the bill in its original format, which would cap the cigar price. The other thing I wanted to touch briefly on is purchase, use, and possession laws. I think last year in our licensing bill, that Delegate Hope sponsored, one of the things that was a good portion of that bill was removing PUP from Virginia. So it was no longer illegal for a youth to have this product or to have a tobacco product. We did see an onslaught of bills this year that ranged from, you know, just dealing with possession, use, and PUP on school grounds to misdemeanor charges to civil penalties, all of which we at the Lung Association oppose, as we oppose any form of PUP. We did, however, see House Bill 1946 and Senate Bill 1060 by Delegate Hope and Senator Eben did put purchase, use, and possession laws back into the statute. However, the only penalty is confiscation of the product. Those bills did pass and are awaiting governor's signature. You know, I think as part of the bill, there was some language included around, you know, a work group around the licensing program. You know, I think we talked about a licensing program last year, and it ended up being kind of a limited licensing program. But in order to really address youth use, states need to have a comprehensive licensing program that would be all tobacco retailers, all products with annual checks, graduated fines, including license suspension or revocation. And so that kind of, if there are more questions about that, I think Thomas and I can answer them later, but that's the kind of the best practice gold standard of what a licensing program should look like, that will really ensure that retailers are following the law. Next slide. Okay, as I mentioned, how to find out about our work around encouraging the governor to sign our tobacco surcharge bill. So there's a couple of ways to get involved. Our friends on the call from the Tobacco Free Alliance of Virginia. It is a wonderful group. It's a wonderful coalition. Great place to learn a lot of great information and become involved. So if you're not involved, I would encourage you to go to the website and become a member. And then also the American Lung Association's Action Network. You could register on that link, take action. You will receive state-based action items. So for example, we just recently did a action alert encouraging the governor to sign the tobacco surcharge bill. And so I think it's really it's really a great place to be involved. It also allows for you to be involved in some of the federal work that we're doing as well. Next slide. And there are contact information for Thomas and myself. If in fact anybody wants to reach out, feel free. We're happy to engage in conversation and answer any questions.
Great. Thank you so much, Thomas and Alex. We do have a few questions. We're going to start with a question from our group, from our program. And that is, what are the loopholes in the Virginia Clean Indoor Air Law that need to be improved to get a better grade that's above an F?
I talked a little bit about this during the presentation, but it's certainly the restaurants loopholes. I don't think the state laws touch it's a non-hospitality, private workplaces as well too. So like manufacturing places, even in public places as well too. There certainly could be, I know schools has already been addressed, for example, so that's certainly part of it too. But but a lot of other public places could still allow smoking, although most of them don't. So.
Great. Thanks for that. And then questions from registration that we have. First one is, what is being done to stop tobacco shops from selling to teens? Many of the teens we work with report that they just walk in and are able to buy.
Yeah, so I think the important piece of that question goes back to what we talked about a comprehensive licensing program, right? And so, being able to identify every tobacco retailer that is operating or has a license, by licensing them and ensuring that they are abiding by the law. And so the licensing program has to have, all tobacco products and all tobacco retailers. It needs to have some type of an annual check. So somebody is going in to check to make sure that they are in fact in compliance with the law, and then graduated fines. So if as the more fines you have, the more expensive they become. And then after a certain point in time, you have a license suspension or they revoke the license. Thomas, did I miss anything?
No, that's right. I noticed some mention in the chat too of Kentucky's. So Kentucky just passed a tobacco retail licensing bill that I believe is on the governor's desk now. And it's actually it's a pretty strong retail licensing bill. So I'd certainly encourage Virginia folks to check that out. And it was obviously it's good to see progress in parts of the country that haven't necessarily seen it as fast. So,
Thanks for that. And I'll just remind everyone, if there are any additional questions, you can put them in the chat or the Q&A box. So moving forward with the next one, we have, what can we do about these vape shops and other markets that do not card? How can laws be strengthened and enforced?
So I think it's twofold again. I think it's a little bit of the same answer about, a comprehensive licensing program. I will also note that there was a bill last year, House Bill 947, if I have the number correctly. I could be wrong. But it allowed localities to regulate where tobacco retailers were able to set up, basically, and really it focused on the proximity to schools and childcare centers, and so places where kids go. So we did support that bill, and so I think it's twofold. I think there is that component that allows the localities to regulate where these retail locations set up. But I think the other piece of the puzzle is comprehensive retail licensing.
I'd also note
Yeah,
that certainly the flavors, the flavored tobacco products too. So, I mean, it's certainly trying to address those as well too is a big part of why the vape shops are expanding and successful. So.
yeah, and hopefully we'll see more and more localities moving forward with HB 947 and try to address the zoning and density. And the last question I have here is from registration as well. So it says, our ALA report card from Virginia gets a little press, but not much attention. Have other states been able to use it for real change, and how?
So I mentioned this a little bit in my presentation, but I think it goes back to using it throughout the year to generate some accountability for lawmakers, especially around especially when policies that would improve the grades are introduced. So say a smoke-free law is introduced in the legislature, mentioning that what this could do for the grade and state of tobacco control. That's certainly one way to do it. And I think another thing we've seen as well too is people around the time of the report as well too. Using doing a press conference or something, or sharing the report with legislators, other things like that as well too. Actually, Alex, you did a few things with the report in Maryland, or was it Delaware this year too as well? So
Yeah, so I'll echo Thomas's comments about using the report in the media opportunities that we do get. And so the media opportunities, for example, for this year, gave me an opportunity to talk publicly about our work around the tobacco surcharge and do some education about why we want them to be made permanent, right? Why they don't work. And so I think that's an example of how we use the report to try to move change. I think we always get the question, right? And Thomas probably does too when we do interviews about how can we improve our grades, right? I think that's always a question that reporters ask us, and so the report kind of lends itself to be able to say, well, if we did this, the grade would go up. If we, look at compared to another state, and so I think that's an opportunity. Something that we did with the report in Delaware, for example, this year is we had legislators on the House and the Senate each introduce a tobacco use awareness month resolution, and in that resolution, state of tobacco control findings were listed, and both legislators encouraged their colleagues to use the state of tobacco control report in making policy decisions moving forward. And so, she talked about the senator who introduced the bill, talked about, when approached by someone to do something, look at state of tobacco control and see, does it meet the best practice? And so, use that as your guide, so to speak. And we then followed up with legislators to make sure that they all had a copy of it, handy. We also use it quite frequently, when we advocate for a bill. We reference state of tobacco control many times in our testimony and supporting documents to be able to say, this is why we should be supporting this, or this is why we oppose this.
Great. Thank you for that. We have a question from Jane Flowers. She says, a decade or less ago, the tobacco surcharge was promoted by CDC as a strong, promising practice. What changed in the evidence?
I think it was mainly the fact that the effect it was having on health insurance in particular, and that what was found to happen is that people were basically would forego health insurance as opposed to avoid getting the surcharge applied to them, basically, rather than that's not a and that's not something we want to impose, especially on families as well too. I also say I don't know, Alex, do you have anything to add to that?
Yeah, I will say that we do have a fact sheet that we used that has the data sources referenced in them. And I don't have the link handy. But what I'll do is I will get it to Gina and Tiffany, and then you guys can maybe include it as the follow-up, or we can circulate it to Eugene. But there is some data in our fact sheet and some data sources that I think have happened over the years that do show, to Thomas's point, that for a lot of folks, they just forego healthcare. And not only are they foregoing healthcare for themselves, but they're foregoing healthcare for their families.
Yeah, thanks. Yeah, we'll make sure to include that in our email, and we'll also send the slides and the recording. And I see another question from Richard Baker. Can you explain the low grade behind flavored tobacco?
Yeah, so basically, Virginia doesn't have any laws that would restrict the sale of flavored tobacco products. So that is where the low grade comes from. Some states have, and then like DC has a really strong law that prohibits the sale of flavored tobacco products in almost all locations, and so that's why they get the A grade. So there are a few intermediate steps in there. So like New Jersey is an example. They get a D grade because they restrict this. They've prohibited the sale of flavored e-cigarettes statewide. So there are a few intermediate steps in the grade as well too.
Can I ask, so with that, I feel like that'd be such a hard law to enforce, flavored cigarettes, just because we know they're so out there. Have those states, and I'm sure I can maybe look it up, but I was just curious if those states, because they've done that, they've removed flavored, have they seen a reduction in youth use?
Certainly, so Massachusetts has done some, and they're one of the states that has the strongest laws. They've done some evaluation of their law. I think in the year after they saw a I think it's a 25% overall reduction in cigarette sales, and then I think it was like high 90s in terms of reduction in menthol cigarette sales. So and Massachusetts does have a kind of a unique local public health structure, so that certainly helps some enforcement as well too. I'll just also note that California also has a law too, and what they had to go back and do some additional legislation to kind of work on enforcement of the law as well too. So there are some things that can be done to improve in that regard too. So
yeah, and I'll comment quickly on DC's because I worked on that one, and probably so have some of the colleagues that I are probably on this call. The DC law is comprehensive, and we have not done necessarily an evaluation of the law, but we have seen, interestingly enough, and we kind of think it correlates. We're not 100%. We have seen tax revenue decrease. And so we think that there could be a correlation maybe of not as many products being sold. And enforcement does, we are in contact with the enforcement, the agency that does the enforcement. And we have had to provide kind of some guidance. And luckily the Department of Health has worked with us and the enforcement agency to provide guidance on, this is technically a flavored product, right? This is a product that meets the definition of the law. and this one doesn't. And so we have had to do that. I think to Thomas's point, the industry continues to be creative and move quickly and push the boundaries sometimes. And so we have seen that. And we saw it in DC with online sales too. We saw with DC online sales specifically around Zinn. But luckily, in DC, we have a very kind of supportive infrastructure, and the AG's office got involved in that.
Great. I don't see any more questions. Check in. So Gina, if you want to.
Yes, thank you. I did have one quick question. You mentioned that 6 states had increased their funding of $1 million or more. Where did that funding come from? Or do you know? You may not know. I just was curious when you said that.
It varies by state. In a lot of cases, it comes from either Tobacco Master Settlement Agreement funds, or tobacco tax funds. In some cases, it's also due to the Juul settlement funding as well too. So the state's using basically all of that for e-cigarette prevention and cessation. So and other and education as well too. So that's also been something we've been seeing in a lot of states that has kind of bumped up their funding in recent years. So
Okay, that's great to know, as we're always looking for additional funding here in Virginia. So thank you so much for the presentations, Thomas and Aleks, and everyone for being on the call. As you can see, we do have a lot of work to do here in Virginia. I think some areas where we can improve and should kind of look to work forward on this, or of course, our clean indoor air law, retail licensing, and of course the retail zoning that is looking promising in many of our localities here in Virginia. So lots of work to do. I think we have many committed and enthusiastic partners, like everyone on this call, that wants to know exactly where they can work to improve these policies. So we will be working, our program will be working. Aleks and Thomas, we appreciate your support as we move toward improving some of the laws that are here in Virginia. So thank you so much. As I think Natalie said, we will be sharing the PowerPoint, the links, and other information in a follow-up email to everyone on this call. And we also encourage everyone to join us May 20th for our next Tobacco Free Tuesday webinar, where we will be discussing House Bill 947 and how some localities are doing new zoning laws to increase that work with the retail locations in the area, and doing really promising work in the locality. So that will be kind of one that really plays nicely off of this presentation here today, and it's actually how we're improving our policies at the local levels. I'm so excited to hear from Dr. Morgan Snell about her work in Virginia with that. So please, everybody, attend that, share the resources about that webinar with everyone you know. So we have a couple days to spring. We're going to give you about 9 minutes back to your day. Enjoy the weather outside for the next few days. I think it's going to be gorgeous where I am in Central Virginia. And I look forward to seeing all of you back here in May. Enjoy your week. Thank you.